Whenever we rejuvenate the upper eyelid, we really have to look at the lower eyelid as well to make sure that things are harmonious and balanced. And oftentimes when there's aging in the upper, there is aging in the lower. And what do we see there? Sometimes we see excess skin, but we also see shadows. And the shadows are what really make us look tired. And the shadows come from two things, the bags. Fat pockets. 1, 2, 3 separate fat pockets on the lower eyelid. That is, again, fat that's independent of the fat on the rest of your body. Whether you gain weight, lose weight, it's not going anywhere. And those fat bulges can bulge out and create a shadow. Oftentimes right underneath this bone of our orbital rim, you'll also see fat being lost in the fat pockets here in the tear trough underneath the cheek. And that can cause a trough. So when you have a big bulge and a low trough below it, it makes a big shadow. So that's where we do a very cool scarless lower lid blepharoplasty, where we don't have to cut on the skin necessarily. We can go from inside the eyelid and find these 3 little pockets of fat, and we tease out the excess. Either we cut it out, which we often do, or we can redrape that fat down to fill in the trough. But if we cut them out, then usually we take a little fat from the abdomen or the inner thighs, and then we can inject fat, not here where we remove the fat, but where the troughs are underneath it. And by doing that, we've brought the bulge down, the trough up, and we've evened out the texture and the shadows significantly. It'll never be 100% even, but we know with fat transfer in this technique, we can get them very, very smooth. So that's how we treat the upper eyelid with a temporal lift to look rejuvenated and still like yourself.